The symptoms of incomplete abortion include passage of large blood clots or the fetus and some products per vaginum, also severe low abdominal pain. The signs that are usually elicited are uterine size is smaller than the dates, and if bleeding is severe, pallor or shock could be present. As collapsed and peripheral vessels, fast pulse, falling BP, and cold, clammy skin. The cervix is dilated with the fetus already aborted. A whole placenta or parts thereof may be present within the uterine cavity. Investigations, FBC and sickling, blood grouping and cross-matching, ultrasound scan to be requested if doubt exists in the diagnosis, especially in early pregnancies. So the main treatment objectives are to resuscitate patients, to evacuate the retained products of conception from the uterus, to prevent infection from antibiotic prophylaxis, to determine the cause of abortion if recurrent, and to prevent risk of resource incompatibility in future pregnancies. On pharmacological treatment, the digital curettage during vaginal examination to remove as much of the retained tissues as possible. Surgical evacuation of retained products of conception, for example, manual vacuum aspiration, that's MVA, with or without anesthesia. The post-abortion abstention from sexual intercourse for at least 2 weeks. The post-abortion counseling and psychological support, including family planning. Pharmacological treatment, if in shock or severe bleeding, if IV fluids and blood transfusion as necessary, and abortion with uterine size less than 12 weeks. You give ergometrin IM or IV 500 micrograms stat, or misoprostol oral 600 micrograms stat, or misoprostol sublingual 400 micrograms stat. Abortion with uterine size more than 12 weeks or 24 weeks unless you give misoprostol oral 600 micrograms stat or misoprostol sublingual 400 micrograms stat. An abortion with uterine size more than 24 weeks, you give oxytocin IV 20 units into 1 liter of sodium chloride 0.9%, or infuse at 30 to 60 drops per minute, or misoprostol oral 600 micrograms stat, or misoprostol sublingual 400 micrograms stat. And to prevent infection, you give amoxicillin oral 500 milligrams 8 hourly for 5 to 7 days, and metronidazole oral 400 milligrams 8 hourly for 5 to 7 days. To prevent infection, that's in patients with penicillin allergy, you give erythromycin oral 500 milligrams 8 hourly for 5 to 7 days, and metronidazole oral 400 milligrams 8 hourly for 5 to 7 days. To prevent resource isomonization, you treat appropriately. That is, you give anti-D RH immune globulin IM 300 micrograms stat, that's 1500 units, that's within 72 hours of abortion.